What is cumulative risk for bone cancer? Imagine a way to understand your overall chance of developing bone cancer over your lifetime. That's what cumulative risk is all about. It measures the probability that someone will develop this disease from birth up to a certain age, like 74. Since bone cancer is quite rare, the cumulative risk reflects that low likelihood. Studies show that about 0.09% of men, or roughly 1 in 1,000, might develop bone cancer by age 74. For women, the risk is slightly lower, around 0.07%, or about 7 in 10,000. This number might seem small, but it helps doctors and researchers understand how common or rare bone cancer is in the population. Several factors can influence this risk. For example, genetic predispositions play a role. Conditions like familial retinoblastoma, Rothman-Thompson syndrome, or mutations in the TBXD gene linked to familial chordoma can increase the chance of developing bone cancer. If someone has a family history of these conditions, their risk might be higher. Pre-existing bone conditions also matter. Diseases like Paget's disease of bone, multiple osteochondromas, or cartilaginous dysplasias can sometimes turn into malignant tumors, raising the risk. Environmental factors are another piece of the puzzle. Past radiation treatments to bones or exposure to certain chemicals may slightly increase the chance of developing bone cancer later on. Age is important too. Bone cancers are more common in children and teenagers, which affects how the risk accumulates over time. Overall, the concept of cumulative risk helps us see the big picture of how likely someone is to develop bone cancer over their lifetime. It combines all these factors into a single number, giving a helpful perspective for public health and screening strategies. It's crucial to remember that this is a statistical measure. It doesn't predict what will happen to any one person. Your personal risk depends on your unique medical history, genetics, and environment. For personalized advice, it's always best to talk with a healthcare professional. In summary, the cumulative risk for bone cancer shows that, while the chance is low for most people, those with inherited conditions or certain bone diseases face a higher likelihood. Understanding this helps in early detection and monitoring, especially for those at increased risk. Always consult your doctor for an assessment tailored to your specific situation.